Hello, my name is Jeremy with Faithful Guardian Training Center, and today we're going to be talking about shock. Specifically, we're going to be talking about neurogenic shock today, which is a form of distributive shock. So the big thing about neurogenic shock is that it is result from spinal cord damage or spinal cord injury. So what you see is these patients are going to have a back injury of some sort, or maybe like a spinal contusion, a spinal concussion, something that may not necessarily be a break of your back, but can definitely cause some swelling internally and put pressure on your nerves. And so what happens with this type of shock is your body loses the ability to send signals past the point of the injury. And so, for example, what this means is that let's say, for example, you break your T12, which is your 12th thoracic vertebrae, and you end up in a neurogenic shock state because of this. This means that every nerve that is beneath T12 and that's innervated from T12 onwards means that they are relaxing, essentially, or that they cannot control the impulses that are sent to them. They can't conduct them, the ones that are coming from the brain. So what this causes to happen is all of your blood vessels actually end up dilating, which causes relative hypovolemia due to that vasodilation. So what this is also going to cause is if you think about shock in the typical sense, we always teach that you're going to be cool, pale, and clammy. Well, you're cool, pale, and clammy because your body is shunting blood to the core. In neurogenic shock, this is not the case, because what is happening is you're going to have the blood pooling, and again, that relative hypovolemia due to the increase in the container size. But what these patients are going to experience is they're going to actually experience something. They're going to be cool, pale, and clammy above the level of the injury, and they are going to be warm and dry beneath the level of the injury. So, for example, you can have cool, pale, and clammy arms and torso, but your pelvis, your legs, your feet, all of them are going to be hot and flushed. And this is going to be due to the vasodilation, and you're actually going to be losing heat, an excessive amount of heat from this, because your body is going to lose the ability to control the thermoregulation aspect of it. And so these patients, you definitely need to be wary of the possibility of hypothermia with them. Now, something else that happens is you're actually going to have relative bradycardia due to an inability of your body to release catecholamines, such as epinephrine, to be able to stimulate your heart rate. So one of the classical signs of neurogenic shock is going to be bradycardia, hypotension, and an inability to move your lower extremities. Now, whenever you see those three things in conjecture, you need to definitely be trying to look at if there's a spinal issue, spinal trauma, or maybe some type of disease process that could be causing swelling. So just to go over this one more time, neurogenic shock is a form of distributive shock. So what this means is that you have vasodilation, which gives you relative hypovolemia due to an increase in your container size. You're also going to have relative bradycardia due to the body's inability to release catecholamines. And so you have vasodilation below the level of the injury. And something else that you can look for is going to be a priapism, which is going to be a painful erection due to the vasodilation. And that's neurogenic shock.